Dr. Bashar, what is the problem related to revision rhinoplasty?
Yes, very, very good question. The problem related to revision rhinoplasty, let me just really face the camera to better for the audience to see my eyes when I'm talking. Actually, revision rhinoplasty are very challenging cases because it needs a very, very highly skilled, highly experienced surgeon. And always for me as a surgeon with 30 years experience, I've been practicing, my practice being limited to rhinoplasty and facial plastic surgery since 1993, 31 years now. 70% of my cases are revised cases and revision cases which come from another surgeons and from other places to me for correction. And this actually is a quite difficult situation for the surgeon because now my object and my aim is not really to make the nose beautiful, is to correct the deformity. Patient comes with severe deformity, with loss of cartilage, with loss of anatomy material, with loss of structure, with nose full of adhesions, fibrosis, scarring, and wound contraction. And this is really would definitely affect the result of the surgery because the surgeon he has to rebuild, rearrange, reshape. It's a reconstruction procedure more than a cosmetic procedure. So the patient should not expect a movement more than maybe 40, 50, 60, sometimes maximum 70%. So if he achieves this improvement, he should be very, very happy. Unfortunately, patient forget about all the previous problems, all the previous surgeries, and come to after surgery to blame the last surgeon, the most experienced surgeon. We try to improve the situation, although we explain fully to the patient the outcome, and the patient sign a very informed consent, but still the patient forget everything and wants perfection. It's impossible to get perfection in those cases. Our aim is only to get a almost near normal nose. Of course, we always aim for perfection. We try to get close, but it's not impossible to go to perfection because anyway, there is no perfect healing process. So how to avoid all those problems? The avoidance of this problem is from the first operation is to choose the right experienced surgeon, not to go for a cheaper surgery. Unfortunately, most of the people go for the cheaper surgery, go for people inexperienced, people with 2, 3, 4, 5 years experience. You should look at the patient, at the surgeon background. Patients look for the surgeons who have really 10, 15, 20, 30 years experience. Those are the surgeons who will give you the best result, not the surgeon who has been doing the surgery for only 2 or 3 years. Maybe the surgeon is good in something else, good in sinus surgery, good in breast augmentation, good in liposuction, but has got no experience in the nose. The nose is a subspecialty. The nose and the face is really a subspecialty. So you should always look for the surgeon who are highly specialized, who has long experience with such subject. We have 30 years experience in this, in rhinoplasty and facial plastic surgery. My practice has been limited to rhinoplasty and facelift, blepharoplasty for last 30 years since 1993. So this is really the answer, is to choose the right surgeon and also to be logic and to be sensible and to be reasonable with the outcome of your result when you are going for a revision surgery. This is Bashar Bizrah from our centers in London and Dubai. Thank you for watching. I hope you have done your answer. Thank you.